This is Dr. Michael Ennis again with Ennis Chiropractic. We're an upper cervical specialist, so we see a lot of things that deal with this upper area specifically. And what a lot of people don't know is that we see a lot of kids. And when I say kids, I mean infants. And so I've got a kind of really cool story of a child. This was a few years ago, but they came in, the parents were telling me that the vision in one of their kids' eyes had just all of a sudden gone to the point where they said they may be legally blind. So they went through all the different medical procedures, tests, CAT scans, MRIs, all the stuff. They really couldn't figure out why this child's vision was going blind in one eye, but basically told them after about 4 months of tests that he's going to never have his eyesight again and that he just needs to learn to adapt and live with it. And then the mother was a patient, and she hadn't been bringing her child in at the time, but I had a research paper up on vision and the upper cervical area, and so she asked me, do you think that this could affect my child? I said, well, I don't know, let's bring him in, let's find out. And as it turned out, his atlas at the top was actually off, and that actually causes some very unique issues. Not only does it cause pressure at the area where the brainstem and the spinal cord are, but it impedes something called cerebral spinal flow. That's what nourishes your brain. And if it does that, sometimes it can build up pressure. And the back part of the brain is where all the visual nerves are for your brain, as well as pressure behind the eyes. And so it turns out this little boy's atlas was out, and we actually corrected it. And the unique thing is that about 30 minutes after it corrected, his vision came back completely. It was really an emotional sight. The family was very emotional at the time. And I can't say that it happens like that every time, but it happens a lot. And so this upper area is pretty important.